Before we get into today's topic, I want you to take a moment and remember this. If you've been experiencing changes in your body that you cannot explain, if intimacy have become uncomfortable, and if you find yourself avoiding activities you once enjoyed because of pain, burning, or constant bathroom trips, you are not alone. What you're feeling has a name. It is common, it is treatable, and today we're going to talk about it openly and with clarity. We are talking about something called the Genitourinary Syndrome of Menopause, or GSM, formerly known as vaginal atrophy. So what is GSM? GSM is a medical term that describes the physical changes that happens in the vagina, the vulva, and the urinary tract as estrogen level declines during perimenopause and menopause. These changes are not because you are doing something wrong. They are not because you are getting older in a negative sense. They are simply the way the body responds when estrogen levels decline. So how common is it? GSM affects about 27 to 82% of women. This is not a small group, and this is not a rare condition. And yet, so many women stay silent about it. They are embarrassed to talk about it. GSM is extremely common, and it's also absolutely treatable. If you're watching this and wondering whether GSM might be affecting you, here are some of the most common signs women notice: vaginal dryness, pain with intercourse, burning or irritation, frequent urination or urgency, recurrent urinary tract infection. For some women, the burning or dryness is constant. For others, it only shows up during intimacy. So why does this happen? When estrogen declines, the tissue in the vagina and the urinary tract lose hydration and elasticity. The nerves in the area can become more sensitive. The tissue becomes more prone to micro tears. Even the natural pH of the vagina changes, which can lead to irritation or infection. Understanding this helps remove the stigma and feeling of embarrassment. Your body is not malfunctioning, it is trying to adapt to the new normal. And with the right support, this tissue can heal and restore comfort. So what can be done about it? There are multiple treatments for GSM, and they work. Depending on the severity and your personal health history, options may include local estrogen therapies that directly nourish the tissue, non-hormonal moisturizers and lubricants, pelvic flow therapy, laser or energy-based treatments provided by specialists, lifestyle adjustments that reduce irritation. You do not have to live with pain. You do not have to accept discomfort as your new normal. You do not have to avoid intimacy or activities that once brought you joy. There are solutions and there is relief. If this video describes what you've been feeling, the next steps is simple. Talk to your doctor. Ask specifically about GSM. Tell them your symptoms clearly. This is not a topic to be embarrassed about. This is your health, this is your comfort, and this is your well-being. If this has helped you, make sure to subscribe for more menopause tips you can actually use.